Hello, Provider Nation. Thanks for joining us here at our world headquarters in Washington. I'm very pleased indeed to be joined once again by Len Russ, the chairman of the AHCA NCAL board. Len, welcome back. How are you?
Happy to be here. I haven't been here at least 2 weeks.
Glad to have you, though.
We had a conference today at the White House on the stewardship of antibiotics and the importance that is across the spectrum in terms of overutilization of antibiotics and the fact that our collective immunity systems are being increasingly compromised by this, and that's really affecting the population we serve in the long-term care community and the post-acute care community. And then the elderly who are suffering often from comorbidities and now developing resistance to the drugs that they might need because they received them in a gratuitous, almost excessive way over the years. And so this is becoming a very important issue. Interestingly enough, it was not just the healthcare community as we know it that was participating in this, but there was a segment of this symposium devoted to the veterinary community.
Why is that?
Because the food chain begins with livestock. And the use of antibiotics in the grain and the feed that we use for poultry and livestock already presents compromises to the consumption of those products by the general population. And so we're already being overexposed. And now, of course, there's a movement to have food that's, not genetically altered, not, fed with antibiotic, doctored foods, etc. So consequently, it's become, a big priority for this administration. We also had, interestingly enough, two cabinet secretaries attend, the Secretary of Agriculture and the Secretary of Health and Human Services, Dr. Burwell. And
We'll get into this sector, though, because from the way it looks to a layman, AHC and NCAL have been way ahead on some of this infection control.
No question about it, because we've been ahead on infection control, and as you know, with our quality initiatives on the reduction of antipsychotic medications as well as hospital readmissions. And our next phase, under Dr. Gifford's stewardship, I shouldn't use that word liberally, but I am. Under his direction and the quality cabinet, we've moved into the next phase of our quality initiative, and one of the key objectives is reduction of adverse consequences in general. And one of those is, infection control and dealing with antibiotics in an appropriate manner so we don't create antibiotic resistant organisms, and also ensure that our patient population are not overexposed to antibiotics, so when they do need the heavy guns, so to speak, they're effective.